fine.
Can I have your name and date of birth?
My name is Jemiah Watson. I was born August 19th, 2002.
So you're 18?
Yes.
Okay, my name is Colette Moore. I'm going to be your nurse practitioner and I will be performing your abdominal exam today. Do you consent for me to do your abdominal exam today?
Yes.
Do you also consent that I will be recording this abdominal exam?
Yes.
Okay, before we get started, I'm just going to go wash my hands and I'm going to have you lay down. I'm going to provide the patient with some privacy. So I am going to take these drapes and I'm going to have her cover her hips with one. And then I'm going to have her cover her chest with the other one. I'm going to have her expose her full abdomen. I'm going to have her tuck that under. And I'm looking at all four quadrants of the abdomen, which brings me to the first part of my exam, inspection. So I am checking for color to make sure that she has normal color. I'm looking to make sure she doesn't have any yellowing discoloration or jaundice around the abdomen. I am looking for symmetry and contour to make sure that the umbilicus is midline. I'm making sure she doesn't have any lumps, any bumps, any masses, any bulging, any hematoma, any striae, or any scarring. Scarring would indicate that the patient had a surgery in the past. So I am going to have a lateral look, having a good look at the inspection part of the abdomen. Now I'm going to go to the other end and I'm going to have also a look and make sure that I have a good rise and fall, good peristalsis, and that the shape and color of the abdomen is good. Again, checking for any abscessing, any budging, any engorgement, any hematoma, or any striae. I don't see any of that, so the inspection part of the abdomen looks normal. So now I'm going to move on to my auscultation. In order to auscultate the abdomen, I'm going to need my stethoscope. So I'm going to have my stethoscope here, and I'm going to use the diaphragm to look at the four quadrants of the abdomen. The right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. I am going to be checking for bowel sounds. So I'll get started at the right with the diaphragm of my stethoscope at the right upper quadrant. Here I'll be listening for about 5 to 10 seconds to make sure I hear normal active bowel sounds. Very good in the right upper quadrant. I'm going to move down to the right lower quadrant. Listening for about 5 to 10 seconds. Good right lower quadrant bowel sounds. Now I'm going to move up to the left upper quadrant bowel sounds. We should hear about 5 to 30 per minute. And I'm hearing very good bowel sounds in the left upper quadrant. I'll move down to the left lower quadrant. Then again, very good bowel sounds. Now I'm going to take the bell of my stethoscope and I'm going to do the same thing. I'm going to listen to the right upper quadrant. Move down to the right lower quadrant. The left upper quadrant. And then the left lower quadrant. It is noted that the patient has normal active bowel sounds in all four quadrants. Now I'm going to listen to the arteries of the abdomen, in the regions of the abdomen. She has an aortic artery, the right renal artery, the left renal artery, the right iliac artery, the left iliac artery, the right femoral artery and the left femoral artery. So I'm going to take the bell of my stethoscope and I'm going to start at the aortic artery. And I'm checking for any bruits in the arteries. So no bruit in the aortic artery. So I'm going to move over to the right renal artery. No bruit in the right renal artery. So I'm going to move over to the left renal artery. No bruit in the left renal artery. I'm going to move to the right iliac artery. No bruit in the right iliac artery. I'm going to move over to the left iliac artery. No bruit in the left iliac artery. I'm going to move over to the right femoral artery. No bruit in the right femoral artery, so I'm going to move over to the left femoral artery. No bruit in the left femoral artery. I'm going to take the diaphragm and I'm going to listen again. Right aortic artery. I don't hear any bruit. The right renal artery. No bruit. The left renal artery. No bruit. The left iliac artery. No bruit. The right iliac artery, no bruit. And the left iliac artery, no bruit. Gonna move over to the right femoral artery, no bruit. And the left femoral artery, I have no bruit. So again, I use my stethoscope to auscultate the renal arteries. I don't have any bruits. So now I am going to use my stethoscope and I'm going to check for friction rub. So I'm going to move over to the right of the liver and I'm going to take the bell of my stethoscope. Again, I am checking for friction rub. So I'm going to put my stethoscope up to her right liver, which is located up here in the right. No friction rub. Then I'm going to go over to the spleen. Now, it is normal not to hear anything in the spleen. So, if you hear any dull sounds or anything in the spleen, that will indicate enlarged organs. So, again, using the bell of my stethoscope, there is no friction rub in the spleen. Now, I am going to start on percussions. I am going to use my hand, my dominant hand. I'm going to use my fingers and I'm going to be tapping over on your abdomen. So what I'm checking for is tympanic bowel sounds. This is a hollow drum-like sound that I'll hear in all four of your quadrants. So I'm going to start at the right upper quadrant. I'm going to tap. Okay, then I'm going to go to the right lower abdomen and I'm going to tap. Good tympanic. Then I'm going to go to the left upper quadrant. I'm going to tap. Good tympanic. And then I'm going to go to the left lower and I'm going to tap. Good tympanic. Now I am going to check the border of the bladder. So I'm going to percuss my way down. And once I start hearing the dullness, I know I'm at the border of her bladder. So she has good tympanic sounds. So now I am going to percuss the liver. So I'm going to start at the mid-clavicular. And then I'm going to move my way up from the umbilicus. Once I get to the liver, I'm going to mark it. Keep percussing up until I hear the dullness, not over the bone, but into the intercostal spaces. Then I'm going to mark it. now I'm going to take the measurement tape and I'm going to measure where I marked. And I have about 6 centimeters, which is normal. Then I am going to percuss over the spleen, which I should not feel anything over the spleen. A dull sound would indicate that she has enlarged spleen or splenomegaly. Okay. I'm just going to look at my notes to see if I missed anything. When I was at the spleen, I should have been at the 12th intercostal, the 10th intercostal space. So I'm going to go 12, 11, 10. Going to be here. I'm going to percuss. I don't hear any dull sounds, but if I heard any dull sounds, that would indicate that she has splenomegaly. Now, I'm going to do some palpations. I'm going to take my fingers and I am going to tap on your abdomen. I'm going to do a light palpitation or a superficial, which is going to feel my hands, getting you used to my hands on your abdomen. And then I'm going to do more of a deeper palpitation where I'm going to be checking for any masses or anything. So I'm going to start in the right quadrant, and then I am going to palpate. Do you feel any pain?
No.
I don't feel any masses. Then I'm going to start in the right lower. Do you feel any pain?
No.
I don't feel any masses. Then I'm going to do the left upper quadrant. Do you feel any pain?
No.
No masses. Then I'm going to do the left lower quadrant. Do you feel any pain?
No.
The patient indicated that she didn't have any pain, so now I'm going to go into a deeper palpitation using my hands. So I'm going to press down a little bit deeper in the right upper quadrant. Do you feel any pain?
No.
Then I'm going to do the left upper quadrant. Do you feel any pain?
No.
Do the right lower quadrant. Do you feel any pain?
No.
I don't feel any masses. And then the left lower quadrant. Do you feel any pain?
No.
I didn't feel any pain. She didn't feel any pain, and I didn't feel any masses in any of the quadrants. So now I am going to look at my notes again. Okay, I'm going to palpate the liver, which is also in the right upper quadrant. Should be about a centimeter into the liver. Anything more than a centimeter would be inflammation, and that's not a good sign. So I'm going to take my hand, I'm going to press down under the rib, and then press up and have her take a deep breath. So I feel that at about a centimeter, so this is normal. I'm going to do the same thing for the spleen. I'm going to have her go under the rib. I'm going to have her take a deep breath. And again, it's not normal to feel the spleen, so there's no splenomegaly. Now I'm going to feel the kidney. It is also not normal to feel the kidneys. So I'm going to use the bimanual technique, which I'm going to take my hand and put it under her back. I'm going to press down on the right. I do not feel the right kidney. I'm going to do the same thing for the left. Put my hand under her back, and then I'm going to press down. I do not feel the left kidney. Again, this is normal not to feel the kidneys. So now I'm going to have her take a deep breath. I didn't feel the kidneys. So now I am going to do a series of tests. Okay, so the series of tests that now that I'm done palpating, I'm going to do a series of tests. The series of tests that I'm going to do is checking for any abnormalities. I'm going to start at the right here at the gallbladder, and then I'm going to press down on her belly, and then have her take a deep breath, and then see if she's catching her air. If she had a problem like cholecystitis with her gallbladder, she wouldn't be able to catch her breath. So she doesn't have any problem catching her breath, so that's okay. So now I'm going to check for appendicitis. So I'm going to start at the right lower quadrant, from the umbilicus to the ASIS, and I'm going to go about 3/4 in, and then I'm going to press down hard, and then I'm going to release. Did you feel any tenderness?
No.
If the patient would have felt any tenderness, then I would be indicative of appendicitis. So I'm going to move over to the left. I'm going to do a Raspin's test. So I'm going to also press down deep again, and I'm going to let go. Any tenderness?
No.
If any tenderness went over to the right, that would also be a sign of appendicitis. So now I'm going to do the Soros test. So I'm going to place my hand on the thigh. I'm going to have the patient bend up her knee, have her press down on it. As I press down on her tummy, so we can pull up any abdominal muscles. I'm going to check for any tenderness. Do you feel any pain?
No.
Okay, good. I'm going to do the same thing on the other side. Hand on my thigh. Then I'm going to lift her leg a little bit. Press down on her abdomen. Any pain?
No.
No. Okay. Then I'm going to take her leg in again for the Soros test, for the arbitrator test. So I'm going to bring it in. In. Then I'm going to bring it out. Okay. Good. Then I'm going to do the other side. In. I'm going to bring it outer. And that would check for any peritoneum inflammation. And she doesn't have any peritoneal inflammation. So the next test that I'm going to do is called checking for ascites. And this is called a fluid wave test. So I'm going to take the patient's hand. I'm going to put it mid-abdomen. And then I am going to press up on both sides really hard. Then let it go. I'm going to look for any abnormality or waving in her abdomen to see if she has any movement of fluids. So it was normal. She didn't have any. So then I'm going to have her turn over to her side. And this is helping the fluids go down to the bottom of the abdomen, because that's where it will go be dependent and will go downwards. So I'm going to percuss. And I hear, tympanic sound. As I go lower, of course it's going to get duller. If she had any abnormal fluids, it would be down there independent, and would call the fluid wave test. So that's normal. I'm going to have her lay back on her back. Then I'm going to have the patient sit up. And I'm going to be checking for the CVA, the Costco Vagal test. And I'm going to have her look at her curvature of her spine. And I'm going to be at about the 12th space in the rib. And I'm checking for any tenderness. So I'm going to take my hand, press. Same thing to the other side. Okay. And this concludes our abdominal examination. You did very good. Do you have any questions?
No.
Okay, you did very well. Keep doing what you're doing to stay healthy. Thank you.